Then we can have hemorrhage, which basically is bleeding. Yeah, we've already talked about, for example, stroke. In infarction, mostly we'll be talking about stroke, where we talk about hemorrhagic, which that area that is infected can bleed into it, and so you have hemorrhagic stroke. Or it can just be dead and will appear black in a CT scan. So we call that ischemic. So bleeding into the brain, of course, can be out of trauma. Yeah, but it can bleed as a result of stroke. So primary intracerebral hemorrhage most often is a complication of hypertension. So intracerebral, basically when you talk of intracerebral, it means bleeding into the brain substance itself. And so most of the time it's a complication of hypertension. So when you have an hypertension, high blood pressure that is not well controlled, it's likely to actually cause the small blood vessels within the brain to rupture. And so you end up with bleeding into the brain. That is intracerebral hemorrhage. But we have other causes of intracerebral hemorrhage, which could include cerebral amyloid angiopathy. That is basically a problem with the blood vessels. When you have angiopathy, it's a problem and disease of the blood vessels because of this amyloid accumulation, which may cause it to thin and even rupture. You can also have vascular malformation. For example, you can have a problem with the vessels themselves, so that the walls of the blood vessels are weak, and so they are prone to rupture, and you end up with bleeding. Aneurysm, we talked about aneurysm, that is dilatations of blood vessels, almost like the way a balloon will dilate. And you know, when you have a balloon, if you put a lot of air into that balloon, it's likely even to rupture. Those are aneurysms. Of course, you can also have tumors that can erode into the blood vessels and cause them to bleed. And those are some of the causes of hemorrhage or bleeding in the brain. Of course, you can have other intracranial hemorrhages, mostly traumatic. Yeah, so we can have also intracranial. That is when you talk about intracranial, that is inside the skull. But when you talk about intracerebral, it's into the brain substance itself. So we can have other intracranial hemorrhages, which are resulting mostly from trauma and may include extradural. So you can tell where the bleed, the clot is. That is outside the dura mater. Outside the dura mater. So we call it extradural, or you can also call it epidural. E-P-I-D-U-R-A-L, epidural. So extradural is also called epidural. That is basically that clot will be between the skull and the dura mater. So that is extradural. And then when you talk about subdural, that bleeding will be between the dura mater and arachnoid matter. That's what we'll call subdural. That's what we call subdural clot or hematoma or hemorrhage. Then we have, of course, subarachnoid, that is below the arachnoid matter. So this one mostly will be now inside the CSF. As we had said, the subarachnoid space, this subarachnoid hemorrhage will be inside the subarachnoid space. So that is why it was important that we looked at that meninges so that we can understand where this clot will be. So subarachnoid will be inside the subarachnoid space. Extradural will be between the dura and the skull bone. Subdural will be between the dura mater and arachnoid matter. And mostly those will be traumatic. So of course we have a diagrammatic representation of subdural hematoma. So subdural hemorrhage. So hematoma is a clot. So you can see where it is, how it appears. It appears like if you're talking of a lens, you can talk of this as convex lens. So it will appear convex shaped. The subdural actually will be concave. It is extradural that will appear a convex if you're talking of a lens. Then you can see subarachnoid. It is basically within the subarachnoid space, and you can see it can spread all the way. And then of course you can have tumors. Those are tumors within the brain, or it can be also intracerebral hemorrhage. That is intracerebral hematoma. That is bleeding into the brain substance itself. So you can have a tumor within the brain substance, or you can have an intracerebral hemorrhage or intracerebral hematoma that is within the brain substance itself. Of course, you can know all this effect is likely to cause increased intracranial pressure. Yeah, we talked about stroke, and a stroke we talked of it as being, it could be hemorrhagic or it can be ischemic. And you can see some of the causes of hemorrhagic. For example, we can have aneurysms. Yeah, you can see those microaneurysms. Those are very small aneurysms that are within the vessels that supply the substance of the brain. You can see it there. You can see the subarachnoid. You can also have it bleeding into the subarachnoid space. Yeah, that is the aneurysm can rupture and bleed into that subarachnoid space. And so you can have subarachnoid hemorrhage. Epidural hematoma or extradural hematoma. I said another name for extradural hematoma is epidural hematoma. Most of this is caused by trauma, and most of the time the bleed is from a meningeal artery, a middle meningeal artery most of the time that cause epidural hematoma. So it's mostly an arterial blood. When you're talking about epidural or subdural hematoma. So when you're talking about epidural or extradural hematoma, most of the time it is traumatic or it's caused by head injury. For example, commonly maybe in road traffic accident or a fall, trauma to the skull. And most of the time, there is usually a skull fracture that injures the middle meningeal artery and causing that bleeding. So the bleeding mostly will be arterial blood. And you can see the appearance of it mostly would be biconvex. If you're talking about a lens, it looks like biconvex lens. And you can see it will be between the skull bone and the dura mater. Yeah. Of course, there will be edema, and you can see there is pressure. If you are to look at the brain, you see the ventricles. For example, the lateral ventricle. One of the lateral ventricles is compressed, and so this is likely to cause headache, increased intracranial pressure, and this in itself, if it is not corrected early, it's likely to lead to coma and even death. So most of the time, the treatment here, you have to do surgery to evacuate that clot. You do what we call craniotomy, where you open part of the skull bone and remove it so that you're able to evacuate the clot and be able to stop the bleeders. And then you close back the skull, you put back the skull. So we call it craniotomy. Then this one, you can see a CT scan of the brain. You can see, if you were to talk about the plane there, that is an axial plane, axial or transverse. Most of the time, the CT scans of the head are done axial, usually from the neck all the way through the skull. And so you can see here where the hematoma is. So this will be the appearance, or you can see on the right side of that picture, you can see that that is subdural hematoma or subdural hemorrhage. And the appearance will be more of a concave lens, the way a concave lens will appear. And this epidural hematoma appearing in if you have to look at it in a CT scan, or extradural hematoma, you can see where the hematoma is. And when you usually see the hematoma appearing like in that subdural hematoma, it appears black. We call it chronic. So that will be chronic subdural hematoma. In that picture that we just looked, that will be chronic subdural hematoma. And the next picture where this epidural hematoma, when it appears hyperdense, that is the density looks like that of the bone. This one we call acute epidural hematoma. So this will be acute hematoma. So this will be acute. It will appear like the density of the bone. Once it appears like the density of the brain, the same density with the brain, we call it isodense. Yeah, and then the one that will be darker than the brain is hypodense. So this one will be acute hematomas. Acute hematomas will have a blood clot and they appear white in a CT scan.